Hi everybody, today we're with my friend and renowned spine surgeon, Dr. Choll Kim. So we've done a couple videos on back pain, one of which is more about exercising and non-operative techniques. But if you've gotten to the point where none of that is working and you've gone in and you realize you've got to move to the next step, which is surgery, I'm really curious about what that entails. So, Dr. Kim, can you explain really, the process for determining this patient's going to need surgery, what that looks like?
That is probably the biggest question that I deal with when I have a patient. And having said that, the majority of patients don't need surgery. They just need a lot of really good non-operative care. But I would say out of the 15 patients that I see in the office, 1 out of those 15 will have done reasonable non-operative treatment, and they're still in pain and they still have limitations in their function. And most importantly, their quality of life is affected. And when it gets to that point, then we ask, should we consider surgery? And is there a surgery that would be reasonable? In other words, is it relatively safe and have a high likelihood of working? When you have that, then surgery is a good option.
And is there a time frame that you've identified this? Or I'm assuming it's probably different for everybody, but...
It's different for everybody, but you should give your body at least a few weeks chance to get better on its own. Some people take months, so unless you have like an infection or a tumor or a neurologic deficit, like a drop foot, or one muscle is really weak and the nerve is undergoing ongoing injury, if you don't have any of those things, you can wait as long as you want. You can wait years with degenerative pain.
Okay.
So I would say that most people can wait as long as they want to have surgery and decide the perfect time to do surgery when they have time to take off work and devote themselves to the recovery period, and after they felt like they've done reasonable non-operative treatment.
Okay. Is there any condition that hands down needs surgery? No non-operative treatment is going to fix it?
Yes. Probably the biggest one is something called cauda equina syndrome. It's a
big, huge disc herniation.
And you basically develop severe back pain. You may have weakness in one or both legs, and most importantly, it'll affect your bladder control. And you may be either partially or completely incontinent. If you have any of that, it's a medical emergency. You should get to the emergency room right away and have a professional examine you. Having said that, that occurs really rarely.
Okay.
But I usually tell people, if the little voice inside your head says something's desperately wrong, you should call somebody.
That's good advice.
And let a professional try to diagnose you.
Okay. All right, so after all of the steps that we've taken, what would you say is the next step to moving towards surgery?
All right, so first you have to make the following determination, that your symptoms isn't just annoying, it's affecting your function and quality of life, because we should not do surgery unless it's going to make a big change in your lifestyle.
Okay.
So in other words, say I ask you, how's your back doing? You say, oh, it's a 2 out of 10. And I think it's great, but I come to find out it's because you don't play golf anymore and you're a golfer.
Right.
That would be a problem. A little problem. So I want to hear things like, I can't play golf anymore because every time I play golf, my back hurts. I can't do my underwater basket weaving because every time I do that, my neck hurts, etc., etc. And once I determine that you've tried reasonable non-operative treatment, the next step is to ask, is there a reasonable surgery? So if you had 5, 6 bad discs in your neck, then I don't want to do surgery, because a 5, 6 level surgery is really, really risky. But if you had just one level problem, like a herniated disc, something simple, then surgery would be perfect. So it's a question of not only are you bad enough to have surgery, but is there a reasonable surgery that can be done that will alleviate your symptoms without undue risk?
Okay.
You seem more confused than before.
Well,
so
I did. Well, what you said earlier with the
just look into my eyes.
If you have like 5, level 6, then that's really risky. To me, that sounds like that would really need the surgery, because that would be more painful.
That is interesting that you said that. Okay, so yes, but it's sort of like driving 150 miles an hour on the freeway.
Okay.
If I get home without an accident, then I would have gotten home really fast. But if I get into a crash at that speed, bad things can happen. So it's sort of like that. You may have more pain due to multi-level problems. Not necessarily, though. That's what's weird about the spine. But a 5-level operation is so dangerous that it's better just to live with the pain, believe it or not. Generally speaking, the larger the surgery, the more care you need to take in deciding to proceed with it, because you can always make somebody worse with bad surgery.
Oh yeah, that sounds scary. So if somebody's seeking out a surgeon, what would be the difference between a spine surgeon and a neurosurgeon? Is one more orthopedic? Or does it...
No. Okay, so this question is I used to get asked this question a lot. Should I go to an orthopedic spine surgeon or a neurosurgeon? It kind of depends, but here's the most important thing. It doesn't matter if you're an orthopedic surgeon or a neurosurgeon. It matters if you're a spine surgeon. So
Okay.
I only just do spine surgery. I don't do shoulders, elbows, knees, hips. I know how to examine those areas, but I don't operate on those things anymore. Because spine is already so complicated and technically challenging. It'd be like I'm a professional golfer and a professional baseball player. It's hard to be really great at both. You just need to pick one. So it doesn't matter if you see a neurosurgeon or orthopedic surgeon. Just make sure that there are spine surgeons. They're keeping up with all the latest advancements in spine surgery, which is a lot, very difficult to keep up with. And like any professional athlete, that they do a lot of spine surgeries, because it's like a sport. If I don't take the free throw shot a lot, I'm not going to be very good at the free throw when it comes time for me to stand on the free throw line. So you want to also, once you decide what surgery you're having, you should start asking who does that surgery a lot and is really, really good at that particular surgery for this particular problem. Like professional sports.
Got it. Okay.
Surgery is scary.
I know that you have a couple different techniques for surgery, right? There are different levels, minimally invasive, and also just go in and cut things apart, right?
Well, the way I look at it is you have a problem to fix, and there's more than one way to fix the problem.
Right.
Now, the vast majority of us, like me, we're trained as traditional open surgeons. I just happen to have learned on my own how to do the surgery slightly differently. So if you need to get to the bullseye of a surgical problem, you can either make a big incision and just get right down to it and see the whole thing with your naked eye.
Okay.
And all the surrounding anatomy, so you know exactly where you are.
Right.
That's great, because as a surgeon, I'm not confused. But as a patient, you have this huge wound with blood and higher infection rate, more pain.
And the
there's the ugly scar, yes.
Okay.
And where are you going to put the butterfly tattoo on your back with that big midline incision? All of those questions. Well, you can get to the same target site by making a smaller incision, maybe in a slightly different trajectory, that saves a bunch of important anatomy and decreases bleeding and pain and infection and scarring and things like that. And that's what minimally invasive surgery is. It's just a slightly different way to get to the surgical target site. So I would rather make 2 1-inch incisions instead of 1 big 2-inch incision.
But that sounds more aesthetic. So if I were to say, you've got a hold of my spine, do whatever you need to do it right, versus, well, I don't want a big scar, I would go with the do what you need to do to get it done.
You have to, yes, the first priority is you need to be able to get the job accomplished. Now, if you can do it through a small incision with less bleeding and less pain, that's the way to do it. But if you can't, just do it the traditional open way.
Okay. Are there certain issues that tend to lead more towards the other?
Yes. So I would say that if you have things like a herniated disc or a 1 and 2 level problem, it is awesome to do that surgery minimally invasively. Because it's easy to do, it's reliable, and you can get out of the hospital either the same day or the very next day, even if you have to use screws and rods. And there's a bunch of advantages. But as you start to get more and more complex, like scoliosis, kyphosis, multi-level degenerative problems, then you kind of tend to do more things open, because it's more difficult and more challenging. So working through a small little incision is sort of like building a ship in a bottle. There's some ships you can build in a bottle and others you can't, and that's how you make the decision. Having said that, the vast majority of the things I can still do minimally invasively, but there's still some surgeries that I look at and think, maybe it's better done open.
Okay. Now, would one have a better recovery than the other, or a quicker recovery time?
Yes. The advantage of the minimally invasive surgery, the disadvantage of minimally invasive surgery is that it's more technically difficult, requires more training on the part of the surgeon, and it's just more technically challenging. The huge advantage, though, is that the difference between 1 2-inch incision in the middle versus 2 1-inch incisions off to the side is not just cosmetic. It's all the stuff that occurs underneath the skin with all the muscles and tendons and ligaments. And when you make a bigger incision, there's more muscle damage, more destabilizing changes to the spine, so that now it's not as stable and rigid. and there's more dead space, so you get more likelihood of infection. And in cases where you have to use screws and rods to do a fusion, when you do it open, the level above the fusion has no like dynamic stability because all the muscles are injured. And so it breaks down faster than normal. That's called adjacent level degeneration. So there's a huge array of advantages doing it minimally invasively. And at some point, everyone will do 1 and 2 level simple surgeries in the spine minimally invasively. Sort of like today, almost everybody would fix an ACL reconstruction through an endoscope. But when I had my ACL reconstruction, I was one of the first people to have it done minimally invasively. Before that, and for the majority of people, they would just make a big open incision and do a big
I've seen those scars.
knee scar. And
they're battle wounds.
And you can do a really good job in terms of piecing everything together, but the collateral damage that you impart in doing a traditional open surgery, we really need to take that into consideration when we decide what the best surgery is.
So through minimally invasive, you can still put the rods and everything in that are needed. Now, I'm kind of naive to this. Do those rods stay in there forever?
Yes, unless they need to be taken out, but it's sort of like the fillings in a cavity. Once they're in there and all the bones heal, you can just leave it in there.
And you're permanently setting off the machine at the airport?
No, because spinal implants are made almost all titanium.
Oh, no kidding!
So it's really sexy, but it does not set off magnetic alarms.
Oh, I didn't know that.
But it will show up on an X-ray machine.
Okay.
You know those little X-ray machines where you're like, don't breathe?
Yes.
They'll see that.
Oh, interesting. Okay. All right. So what would you say the recovery time is for both these surgeries?
All right, so let's see, give you an example. Let's say you had a herniated disc, sort of like what Tiger Woods had.
Okay.
You had a microdiscectomy. It's a pretty minimally invasive surgery to begin with, a 1-inch mini open incision. The recovery from something like that for most of us is about 2 weeks.
Okay.
You could do that surgery with the laser endoscope through a small poke hole incision looking on a TV camera, the LES procedure, laser endoscopic spine surgery. That surgery, if you do that surgery for a herniated disc, the recovery is only a few days.
Okay, and when you say recovery, does that mean we're back on the golf course?
Yes, so somebody like Tiger Woods probably did not even swing a club for about 2 weeks. I don't know for sure because I wasn't his doctor, but there are going to be limitations specific to each patient, but we want the wound to heal and we want the patient's incisions to kind of stay closed whenever you make a mini open incision. So that usually takes like a week or two for things to start getting stable. When you have a little poke hole and you put a little Band-Aid on there, there's really not any waiting for any soft tissues to heal. You're just waiting to see if the underlying problem gets better. So really there's not much of a recovery. It's more technically difficult, but that's the difference with something like a herniated disc. If you needed a fusion like Tiger Woods' subsequent surgery, the one that he just had, so he had microdiscectomy and the disc degenerated thereafter, and now he just had an arthritic joint. In those cases, you have to do a fusion. So he had a fusion, which is a big deal, but you can see he won the Masters after that. The fusion procedure takes more like months to get better from. So if he had a traditional open fusion surgery, he had a minimally invasive A-lift surgery, he probably would have not played for at least a year, if not longer, if ever. By doing it minimally invasively, I think he got back in 6 to 12 months. And let's face it, he's a professional golfer. All those muscles that not you, but me and normal human beings, we don't need that much of those back muscles. But if you're playing golf, those muscles need to be not only strong, but they need to be coordinated.
Right, dynamic. I mean,
yes. He knows exactly. He knows exactly how to fire all those muscles at precisely the right time. You want those muscles to be uninjured. So minimally invasive surgery for somebody like Tiger Woods is not only important for the rate of recovery, like getting back to it quicker, but long term in terms of his ultimate capabilities. So there's a lot of advantages of doing minimally invasive surgery, and for people like Tiger Woods and other high-level athletes, people that have really demanding jobs that need to get back to work, that's the typical person that comes to my practice that's going above and beyond the traditional open treatments and trying to get the state-of-the-art minimally invasive treatments. It's an advantage of that initial recovery and a long-term advantage of kind of ultimate function.
So is there anything that we can do to help prepare us for surgery?
You do not want to have surgery when you're like at the bottom of the bottom. So I've heard of a lot of patients saying, don't go see a spine surgeon until you're in a wheelchair. That's not a great idea, because the longer you wait and the more damage that you have and the more debilitated that you get, the harder it is to recover from the surgery, and turns out the ultimate outcome of the surgery is not as great. So you have to find that right amount of time. So don't wait too long, but don't wait too little, and try to stay healthy and fit right before your surgery. Don't decide you're going to have surgery and say, all right, my surgery's in a month. I don't really need to do anything. I'm just going to eat like a pig and just lay around the couch, because after surgery I'm going to be perfect.
I'm going to lose weight so I can eat the french fries now.
So you want to stay healthy and fit all the time, all the way up until the time of surgery.
Okay.
Yes, whenever you're starting to think about surgery, you should consider it like one of the most important decisions that you make in your life. You should get some help, get a wingman to kind of help you do some research, get more than one opinion from spine surgeons, at least get a second opinion, if not a third, if you're thinking about surgery, and really think about the pros and cons of surgery. Don't just rush off into things. It's easy to do when you're suffering and in pain, just to like make a desperate decision and just pray that things go well. And I caution everybody, take your time, be thoughtful, ask for lots of opinions and advice, and leverage all your friendships to figure out how to go about getting all this care, because it's complicated.
Okay. Thanks, Dr. Kim, for having us here today.
Thanks for having me.
We hope that we answered some of your questions today. So if you've got any comments, please feel free to send them over to me. And thanks so much for watching.